An ectopic pregnancy is a pregnancy that occurs when a fertilized egg implants itself outside the uterus, which is the normal place for a baby to grow. Typically, fertilization takes place in the fallopian tube, and then the fertilized egg travels down to the uterus for implantation. However, in an ectopic pregnancy, the egg implants in the fallopian tube, which connects the ovaries to the uterus. It's important to note that ectopic pregnancies can also occur in other locations, such as the cervix, ovaries, or even the abdominal cavity. There are different types of ectopic pregnancies depending on where the implantation happens. 1. Tubal pregnancy. This is the most common type, occurring in the fallopian tube. 2. Cervical pregnancy. This is a rare type where the egg implants in the cervix. 3. Ovarian pregnancy. This is another rare type where the egg implants in the ovary. 4. Cornal pregnancy, where the egg implants in the horn of the uterus. And 5. Abdominal pregnancy, the least common type where the egg implants in the abdominal cavity. Note that an ectopic pregnancy is not viable, meaning it cannot result in the birth of a baby, for several important reasons. Firstly, the fallopian tubes and other locations outside the uterus are not designed to support a growing embryo. They lack the necessary space and blood supply to nurture the developing pregnancy. This means that the embryo cannot grow and develop properly. Secondly, there are significant health risks to the mother. As the embryo grows, it can cause the fallopian tube or the other tissue it's attached to stretch and potentially rupture. This can lead to severe internal bleeding, which is extremely dangerous. Thirdly, the potential for significant blood loss is very high. Internal bleeding from a ruptured ectopic pregnancy can lead to severe blood loss, causing shock and potentially death if not treated promptly. This is why an ectopic pregnancy is a serious medical emergency and requires immediate attention. If you experience symptoms such as sharp or stabbing pain in the abdomen, pelvis, shoulder, or neck, unusual vaginal bleeding, or severe dizziness and fainting, it's crucial to seek medical help immediately. Diagnosis is typically confirmed through ultrasound imaging and blood tests. The specific treatment approach depends on several factors, such as the location of the ectopic pregnancy, its size, and your overall health. An ectopic pregnancy can be treated with two main treatment methods. 1. Medication. In some cases, if the ectopic pregnancy is small and hasn't ruptured, a medication called methotrexate might be used. This medication works by stopping the growth of the cells in the ectopic pregnancy, allowing your body to naturally reabsorb them. This treatment is typically used for ectopic pregnancies located in the fallopian tubes. It's crucial to understand that methotrexate requires close monitoring with blood tests and ultrasound scans to ensure its effectiveness and avoid complications. 2. Surgery. Surgery is often the preferred treatment option, especially for larger ectopic pregnancies, ruptured ectopic pregnancies, or those located outside the fallopian tubes. There are two main surgical approaches. 1. Laparoscopy. It is a minimally invasive surgery using a small incision in the abdomen and a laparoscope, a thin, lighted tube, to visualize the ectopic pregnancy. The surgeon can then remove the ectopic tissue using surgical instruments inserted through the laparoscope. 2. Laparotomy. This is a more traditional surgery requiring a larger abdominal incision to access and remove the ectopic pregnancy. This approach might be necessary if the ectopic pregnancy has ruptured or if laparoscopy is deemed too risky due to factors like severe internal bleeding or extensive scarring. Remember, treatment decisions are made by your doctor based on your specific situation. So, you might be wondering, what are the causes of an ectopic pregnancy? Well, the exact cause of ectopic pregnancies is not always clear, but several factors can contribute. 1. Previous ectopic pregnancy. Having had one before increases the risk. 2. Inflammation or infection. Conditions like pelvic inflammatory disease can damage the fallopian tubes, increasing chances of an ectopic pregnancy. 3. Surgery. Previous surgery in the pelvic area or on the fallopian tubes can also cause an ectopic pregnancy. 4. Fertility treatments. Certain treatments, like in vitro fertilization, IVF, can increase the risk. 5. Contraceptive devices. Although intrauterine devices, IUDs, are highly effective contraceptives, a small chance of pregnancy still exists. If pregnancy does occur with an IUD in place, it's more likely to be ectopic because the IUD might affect egg transport or implantation. Recognizing the symptoms of an ectopic pregnancy is crucial. They often appear between the 4th and 12th week of pregnancy and can include 1. Pelvic pain. This is often a one-sided pain that can be sharp or cramping. 2. Vaginal bleeding. This bleeding might be lighter than a normal period or spotting. 3. Shoulder pain. This might seem unrelated, but it can be a sign of internal bleeding from a ruptured ectopic pregnancy. Nausea and vomiting. These are common pregnancy symptoms, but they might also occur with an ectopic pregnancy. Feeling dizzy or faint. This can happen if there's internal bleeding. Risk factors. One significant risk factor is a history of previous ectopic pregnancies. If you have had an ectopic pregnancy before, you are more likely to experience another one. Another major risk factor is pelvic inflammatory disease, PID, which is often caused by sexually transmitted infections like chlamydia or gonorrhea. PID can lead to scarring and damage in the fallopian tubes, making it difficult for the fertilized egg to pass through to the uterus. Surgery on the fallopian tubes or in the pelvic area can also increase the risk of ectopic pregnancy due to potential scar tissue formation. Women who have undergone fertility treatments, such as in vitro fertilization, IVF, may face a higher risk as well. Additionally, using assisted reproductive technology can increase the chances of an egg implanting outside the uterus. The use of certain contraceptive methods, such as intrauterine devices or tubal ligation, having your tubes tied, can slightly increase the risk of ectopic pregnancy if pregnancy does occur despite these methods. Another contributing factor is endometriosis, a condition where tissue similar to the lining inside the uterus grows outside it, which can cause scarring and blockages in the fallopian tubes. Age also plays a role, with women aged 35 and older being at higher risk. Smoking is another significant risk factor, as it can damage the fallopian tubes and impair their function. The more you smoke, the higher the risk. Hormonal imbalances. In rare cases, hormonal imbalances can affect the movement of the egg through the fallopian tubes, potentially leading to ectopic implantation. It's important to remember that these are risk factors, not guarantees. Many women with these factors have healthy pregnancies. However, being aware of them allows for early detection and intervention if needed. Consulting your doctor about your individual risk factors and any concerns you have is always recommended. So, how can one prevent ectopic pregnancy? Well, preventing an ectopic pregnancy entirely may not always be possible, but there are several steps you can take to reduce your risk. One of the most important preventative measures is to protect yourself from sexually transmitted infections, such as chlamydia and gonorrhea, which can lead to pelvic inflammatory disease and subsequent damage to the fallopian tubes. Practicing safe sex by using condoms and getting regular STI screenings can significantly reduce this risk. Quitting smoking is another crucial step, as smoking is known to damage the fallopian tubes and impair their function. 3. Maintaining regular checkups with your healthcare provider is also essential. If you have a history of pelvic inflammatory disease, endometriosis, or previous ectopic pregnancies, discussing your medical history with your doctor can help in monitoring and early detection. When considering fertility treatments, ensure that they are conducted under close supervision by a qualified healthcare provider. Assisted reproductive technologies, like in vitro fertilization, IVF, should be carefully managed to minimize the risk of ectopic pregnancies. For those using contraceptive methods like intrauterine devices, IUDs, or who have had tubal surgeries, it's important to follow up with your healthcare provider to ensure these methods are working properly and to address any complications promptly. Understanding the seriousness of an ectopic pregnancy and recognizing the symptoms can save lives. Early detection and treatment are essential, so if you have any concerns or experience warning signs, seek medical help right away. Thank you for watching. Please subscribe, like, comment and share this video.